London will move into England's highest tier of COVID-19 restrictions, the government said on Monday, citing increased infection rates. UK Health Secretary Matt Hancock said the rise in cases could overwhelm hospital services. He added that more than 1,000 cases of the new coronavirus variant had also been identified, mainly in southeastern England.
Similar variants have been identified in other countries over the last few months. We've notified the World Health Organization about this new variant, and Public Health England is working hard to continue its expert analysis at Porton Down. Mr. Speaker, I must stress at this point that there is currently nothing to suggest that this variant is more likely to cause serious disease, and the latest clinical advice is that it's highly unlikely that this mutation would fail to respond to a vaccine. But it shows we've got to be vigilant and follow the rules, and everyone needs to take personal responsibility not to spread this virus.
Earlier this month, the government implemented a three-tiered system of restrictions in England to try to keep a second wave of the virus under control after a month-long national lockdown. More than 40% of its citizens were placed in the highest risk category. However, London was initially left in the middle tier of restrictions. The main difference between the top alert levels is that bars and restaurants, which can stay open under certain conditions in Tier 2, must close their doors in Tier 3 and can only operate takeaway services. There are also additional curbs on socializing, but workplaces and schools are told to remain open. England's Chief Medical Officer, Chris Whitty, said the detection of the new variant was not the reason to put London in the highest level of restriction. He said that there was no evidence that the clinical outcome was different for the new variant. The World Health Organization has confirmed that Britain reported the variant, but added that mutations were not uncommon, a view that has been echoed by several other experts.